through a short presentation. Thank you very much. Thank you. Sorry. Please allow me to recognize part of the team that we had yesterday. Please, wale tulikuwa nao ENT, please. Unaweza simama? Just wave. Just wherever you are, just wave. That's it. Okay, thank you.
Good morning, church. Praise the Lord. God is good. And all the time. Thank you very much. Archbishop, church leadership, congregation, and those who are with us today, and my team too. I want to register my appreciation for this opportunity to share some information on hearing and ear care. I'll request for our presentation to be projected. As you can see from that slide, or maybe, I know Dr. Munir said I'm Pauline Njogu. Yes, I am an audiologist. Audiology is the science of hearing and balance. I am a mother, a wife, and a grandmother. I have a very good history with the ACK Church. I was baptized by Archbishop, the first Archbishop, and I was confirmed by another Archbishop. So I have a good history. I don't know what the current Archbishop will do to me. We are talking about hearing, and I will talk about the ear. We have a picture of the ear. I please project the ear. God created us in a very amazing way, and we have various organs. But since I deal with the ear, I'm going to give it a bit of a hype. It is a very special organ, wonderfully created, and I'll take you a little bit back to school, so bear with me during this presentation, just to remind you that what we see on the sides of our heads, most of us have 2 ears. Maybe you've never seen somebody who doesn't have the outer part of the ear, but there are. We see them quite a bit, especially in young children. And allow me, since I'm quite far from you, to remove the mask, and I'll explain why as we go along. The ear, just to remind you, is divided into 3. We have the outer ear, that's a bit yellowish. And what you see, you don't see the whole of the outer ear. When you look at whoever is sitting next to you, you only see the outer part, which is the pinna. But there's a pathway. We call it, there's an entrance to the ear, which goes right inside, and we love putting sometimes small things inside, either to clean or to scratch. Sometimes you feel itchy and you try to scream. Remind me if I don't see it, you shouldn't do those things. We then proceed to the middle ear. The middle ear starts from the eardrum. You can see it. There are some little bones in the ear, and it's connected to the throat by a tube called the eustachian tube. And sometimes you feel like you are very full, your ears are very full, you try to push the pinna in a little bit, because sometimes you feel the pressure is not equalized inside and outside. From there we go into the inner ear, and that's where we start the sense of hearing. Please, a little bit lower. The cochlea, which looks like a snail. And next, on the left of the cochlea, is the semicircular canals. Those are the ones that deal with balance. So, and onwards after the cochlea sound is interpreted in the cochlea, like the musical people. By the way, I'm also a church choir member. I almost joined you when you were singing. And from the cochlea onwards onto the brain, there's a little nerve. I don't know whether it's visible at the cochlea. So the interpretation of sound is done in the brain. That's where you do the actual understanding of what has been said or what you have heard. Let's go on. And next, please. We have different hearing levels. I have had people say there are people who hear very faint sounds or very soft sounds. They say they have very good hearing. We have what we refer to as normal hearing. It's greenish on our graph. But as you go lower and lower, you have different types of hearing loss. From normal, we go to hearing losses. A slight hearing loss, which we call mild, is in blue. In yellow, we come to moderate. I don't know what that color is, maybe orange. We go to severe. And the last part of hearing, that is the profound hearing loss. And that is what we call deafness. So the person who is at the lower level can't hear what I'm saying unless they have something to amplify the sound. And that graph, we measure hearing in two aspects. The loudness, what we call decibels. A lot of people use decibels. I've heard it said. And our graph is from the softest to the loudest. We go up to 120. And 120 is equivalent to a gunshot or to an airplane taking off, or a very loud band. So as you come from top to bottom, it gets louder. Another aspect that we use for testing hearing is pitch or frequency. Like in the choir, let me use the choir because I'm a choir member. The low frequency is on the left, and that's the bass. As we go towards the right, we go to the high frequency. Do we still have descants? Descant? That's higher than a soprano? I'm telling you, voices change. I used to sing the descant, but now you can hear my voice. As you grow older, it also goes down, but I enjoy it. So low to high, because sounds have either low or high frequency. A sound like S, that is high frequency. A sound like that is low frequency. Men, mainly low frequency. Women, mid frequency. Children are high frequency. Their voices are quite high. Next, please. Now, you remember the ear? Hearing problems can occur. I mean, with everything in this world, even in our bodies, sometimes things don't go the way they should be, and therefore we can have hearing problems. And they can occur either in the outer ear, the middle ear, or in the inner ear. And that's why treatment is different. Let's go on. I'll explain that later. We have statistics which show that about 430 million people in the world, and that's WHO, have hearing loss. One level or the other. Remember, we have mild to profound. And 80% of them live in developing countries. I think middle and, low-income developing countries. And Africa and Kenya, we are among those. And fortunately, 2/3 of them are children for different reasons. As we are going to see later, but they're more likely not even to know they have hearing loss. From our census, I checked, they say about 150,000 were counted to have hearing loss. But I asked myself, is that true? Most likely these are the deaf ones, the one that profound. Maybe people don't want to say they don't hear very much, because you still can hear. If I ask you, do you hear well? Usually it's yes. But if we take statistics from mild to profound, what we call disabling hearing loss, we are going to get many more. And I want to stress here that many of the problems that cause hearing losses, or the causes of hearing loss, are preventable. So prevention is a very key aspect of hearing care. Next, please. I'm going to talk about possible causes. Yes, I am calling them possible because it's not always that you're going to get a hearing loss when you fall in these categories. Before birth, there are children who are born, or people who are born with a hearing problem. And mainly these are caused by genetic factors. They could be hereditary or non-hereditary. Either it runs in family, or it could be because of something that is not hereditary, that's non-hereditary. There is also the intrauterine infections. When the baby isn't born, there are some infections that can affect the organ of hearing, in addition to other things. And the main ones that I mentioned here, we don't have to know them, but it's good to know, are rubella, or it's also referred to as the German measles. And another cause could be cytomegalovirus, which is also a viral infection. So remember, it can occur before birth, when the child is still being formed in their mother's womb. Other causes, as we continue, is during birth. And during birth, and I hear the medical team, I'm sure we are maybe much aware that some injuries can occur during birth, which can affect the organ of hearing. Asphyxia, or lack of oxygen during birth. One of the questions we ask usually, did your child cry after birth? And it's also a possible cause. Jaundice, the time of yellowish, could also be a cause. These are just a few, and they are possible causes. And also low birth weight. Yeah, we have what we say there are some risk. These are risk factors which can result in hearing loss. So just mentioning but a few. After birth, there are various causes. And it means immediately after birth to lifelong until the end. It could be infections. There are various infections that can cause hearing loss. Trauma. We have very much, and injuries, especially blunt trauma. There are also tumors. We also talk about growths, tumors or growths. Trauma is if you really get an accident or you are hit hard by, blunt injury, or blunt trauma, especially where the cochlea sits, around the ear area, then you can get a hearing loss. Ototoxicity, we know there are drugs or medications which can cause hearing loss. One of them, just to mention a few, quinine, if given in large doses, etc. Sometimes you can wake up and find you don't hear at all. You wake up one morning, you have a viral infection, and you get what we call sudden sensorineural hearing loss. And that calls for, immediate treatment by the doctor. There are many. Aging is one of them. Doesn't mean that because you are, I don't know what aging, where you start aging, I think, from the day you are born. But as we grow older, there's a likelihood that we are going to lose some of our hearing. And with aging, we start losing the high frequencies. And I remember one gentleman came to me and said, I think my wife is not okay in the head. I say, why? She wakes up at night and she tells me she's going to check on the chicken. And then I was wondering where the story is going to. And then the chicken are not, being okay. Why do you think so? Because she's hearing sounds, You know the sounds that the chicken make? Yeah. Is it high or low frequency? It's high. So the wife can hear them, so she's going to check whether there is something in the whatever. But the man doesn't hear them, so he thinks they're The guy he actually was suggesting the wife should be taken to a psychiatrist. Yeah, so there are all these things. And there are many causes. I couldn't list all of them, and I've really put it in bold, is noise, loud noise. We have it all over. Look at the matatus. Have you ever tried to tell them to lower the... what do they say? You are muzee. Yeah. Noise sells. When people are advertising, it's very loud. Where we are, some churches, not this one, of course. Yeah? They are very loud music, very loud preaching. And you see, sometimes when the sound is so high, you also try to talk higher because you hear yourself. And it also causes hoarseness. Okay? And all that. That's for another day. And look at our young people. Where I hope we have some young people. I think they were in the youth service. They are listening to? What do they listen to? Yes. You call them, they don't hear. They are crossing the road, they don't hear. I'm telling you, if you try to listen to the volume they put, I don't think you can stand it. And here I have something. It's called the sound level meter. We measure sound. Currently, as I talk here, I can see it's around 70, 75 decibels. The choir, maybe we shall come another day to see how much. Because it can be harmful. It's good to know so that you can regulate yourselves. Okay, let's go on. What are the signs of hearing loss? In children, let me start with kids. One of the things is delayed speech and language development. We have a tendency to compare age, my child was born before yours, but they don't talk yet, okay? And that's quite often. There's also articulation or mispronunciation problems. Yeah? If it's a word like sugar, they might say it in a different way, okay? They will miss the correct pronunciation, although there are other issues that can make children mispronounce. When they are young, instead of saying chai, they can say nyai. And that's part of developing, by the way. When they are very young, they don't call, If it's banana, sometimes they say nana, When they are quite young, it's okay. But when they are a bit grown up and they're saying the same, then we suspect there could be an issue. Now, sometimes we like calling kids, like moms, when the kid is born, you start calling them their names. Like me, Pauline. So children usually turn to their names. So if they don't turn to their name, or when you speak to them, they don't, that's a red flag. And I love grandmothers. I think it's because I'm one. When things drop on the floor, like vifuniko ya sufuria or whatever, the child should startle, Then if there's no startling or reacting to loud sounds, you get a bit worried. And if the child has unintelligible speech, they are talking, yes. Yeah, but sometimes, and they mean it, you can see even from their expression. But sometimes you don't understand. There are many, 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 but I just highlighted a few. I continue. As we grow, those were kids, there are many more. Sometimes you're speaking to somebody, and they are turning the ear to you. They even come quite near you. And that's a red flag. Or if they misunderstand what a speaker has said or asked, you tell somebody, give me that book, they bring you a cook or something else. Yeah, you ask for this, and especially if you are very curly, people say, Ati, they'll just bring something, okay? And asking people to repeat, Ati umesema nini? What did you say? Or speaking very loudly. As I said, you hear yourself, so you regulate the volume of your sound. If you're in the house and people are tending to put very loud volume, you're saying it's high, they put low, and all that, that is also a red flag. And if somebody is looking at your mouth a lot, it's not only, and that's why I've removed my mask, because I'm sure there's somebody here who will benefit by looking at me. Unashikanisha. Yeah, the way you pronounce words. If I say a word like You know, they all look the same, eh? But the context, if you're an adult, you're going to say, oh, unajijazia. Yeah? Kita. I want to say a word like kita. Kitabu. It could be something else, but at least when you're an adult, you can, jijazia. Now, what is the impact of hearing loss? Yeah? Because hearing has a lot to do with our life. Enjoyment, expression, communicating. One of them is social isolation. You feel really isolated because you hear things, you hear emotions, you get everything through hearing. So you start getting either you get isolated and people really don't want to you are always asking, Ati, what did you say? Or whatever. People want to socialize with people who are at par with them. Loneliness, it can be very lonely. People are laughing, they are talking there, and you are in a group, yes, but you are very, very lonely. It really brings a lot of loneliness. You can also get anxiety. I remember a lady who told me every time she's almost getting a heart attack because she's cleaning the house or cooking, and all of a sudden she sees a human being. You didn't hear them knock, you didn't see them coming, so unashtuka all the time. Because you're anxious, supposing a thief comes, supposing something happens, supposing something happens within your home state, what's going to happen? It leads to depression. I've seen a lot of depressed people because you're not hearing, you're not communicating. The society is a bit cruel when it comes when you deviate from the norm a bit. Then stigma. Huyo hasikii. And you know the kind of words we use for people who don't hear? Yeah, they are not very nice. They are not politically correct. They'll start calling you boo-boo. Yeah? Wachana na huyo hasikii. Huyo ni boo-boo. And dependency too. Or you rely on other people. Amesema nini? When you're going to the bank, you don't have any secrets anymore because the cashier will talk to you. People don't have time. And remember, hearing is invisible. You don't see it. Hearing loss. So you have to carry somebody around to be your ears. Unamwambia, anasema. Unamwambia, anasema. Dependency in a lot of areas. Stress and tension is very stressful. Anger and irritability. You're fighting with everybody. Where who's key? You want to listen to news. People are switching off, or you are just seeing mouths doing like that. Unsafe behavior. You are walking in the middle of the road. Pee-pee. Yeah? Yeah, and you get all kinds of insults. Or you walk towards danger. You also avoid events. Yeah? Even your daughter's marriage. Your child's graduation. Yeah? Because sort of like when something starts happening, you also want to hide it, to keep it to yourself. Yeah? Some people also avoid coming to church. Because hatasikia chochote. They tell me, I only see pastor ama reverend anafanya hivi. I started because other people are studying and that kind of thing. So you start avoiding. Strained relationship. Bibi, bwana, mtoto, mwalimu, and everybody. And eventually you see people withdrawing. Huyo ni mbaya ataka kwenda mahali. Anataka kukaa kwa nyumba tu. So we better be careful and look out for these things. Now, all is not lost. Those are just a few of the impacts. Hearing loss can be diagnosed. And we diagnose or we test children after birth. Actually, there are some tests which are done after birth. I think I'll mention it somewhere. But young children are sometimes referred to us, and we have two types of tests. Objective, where the child will do nothing. And a very common one is the first one, ABR. Don't worry about the terminologies. It's auditory brainstem response. Electrodes are attached to the head, to a special equipment. And like ECG or EEG, it's just, it gives us the results. The waves will just form on the computer. And it will show us the level. OEs are autoacoustic emissions. That's a very quick test. I put it on your ear, and in a minute, it will tell me whether you pass or you fail. So it's really not a comprehensive test, but it will tell me. We use them in schools. because we want to see does that child require more further hearing. Tympanometry is a middle ear test. So we have objective tests, and we test kids as early as possible. Bigger children, we do play audiometry. We do a test, an adult test, but in the form of a game. Kids don't even know you're testing them. They think it's a game. They enjoy it a lot. VRA is visual response audiometry, also a kind of test. And we have a distraction test. This is an international test. Was used a lot in the past. Now it's being overtaken by new ones. But I remember when I was younger, I would see people just dangle keys behind a child's ear. Do people still do it? Yeah, it's keys. And the child you turn, eh? It is similar to that. Yeah. So we have tests, and they'll give us the results. And when we get results early, there's something we can do. For adults, the gold standard or the most used hearing test is called the pure tone audiometry, where you put headphones and you respond to tones of different loudness and different pitch or frequency. Then we have speech audiometry to see what is your score. You are being tested with words. So we can see how you respond to sounds. Now, the treatment, there are 3 types: medical, surgical, and rehabilitation. And I'll first talk about the medical management. Although I didn't mention it, one of the causes that can cause hearing loss is wax or foreign bodies. You know, some stuff in there. Like I know kids put beads, maize beans, and sometimes also the earbud. Sometimes it comes out. So the medical management, it's removed, or the doctor or the clinician can do ear serraging, where they use water. The removal is with special kind of instruments. The treatment, depending on what the problem is, there's antibiotic therapy for between 10 and 14 days. And here I put in capitals, it must be completed. We have this habit, not only with the hearing, ear treatment, any other treatment, we take dawa, you feel better, then we don't continue. Antibiotics, tafadhali, we must complete the dosage. Then there's a treatment, a kind of treatment where you are prescribed ear drops, and some of them are antibiotic, others are antifungal, depending on what the issue is. Surgical management, sometimes, remember the middle ear, there can be some fluid. And if there is fluid, it means the sound will be blocked as it goes towards the cochlea and the brain. However, for children, there's some small, let me call them things, which are inserted, and they are called grommets. And those are for children below 5 years. And if it's an adult or people who are over 5 years, there's ventilation tubes. And once that's treated, then the middle ear issue fluid will be sorted out. If there's damage to the eardrum, and actually the eardrum, you remember we talked about trauma? If you really give somebody a good slap, especially over the ear, the drum, because it moves, it's going to get perforated, or it will get injury, or it will tear. If there's an issue like that, the daktari can repair. If there's a chronic infection, or if there are some growths, then there will be reconstruction of the part that is affected. Now I come to rehabilitation, and there are various ways of rehabilitating. And one of them is hearing aids. What is a hearing aid? It is an electronic device that you collect sound from the environment, amplify it, and then when it's fitted on the ear, it means even soft sounds will become very loud. We have different types. Some are manually programmed, and we have also digital, which are programmed with a computer. The sizes, the first one, the blue one, They are not always blue, they are different colors. It's called BTE, behind the ear. The most common type of hearing aid. Then we have little ones, people love them. ITE, in the ear. You insert it in the ear. And here there are many parents who come to us and say, can my child have these things? Unfortunately, if we tell them the advantages, it means that this, you have to change this hearing aid every 6 months. You buy a shoe, you change it, because also the canal is getting bigger and it's very expensive. They're quite expensive. And some for elderly people, very old, not like us who are here, very elderly, maybe at home, they'll not even be able to see it. It's so small. The dexterity is a problem, so they can't even see how they get lost a lot, or they even fall out of the ear. Then there is one which was common in the past. We still see it. It is called body one. You put it in your pocket or hang it in the front. There is a new technology now. It's called the cochlear implant. In the past, if a child was born deaf, I'm talking about deaf at the bottom, profound, there was no hope. These days, cochlear implantation means that something will be inserted in the cochlea, and you can see from the picture there is some kind of a device on the outside, and this child will hear, like, especially if it's done early, they will develop speech like any other child who was born with normal hearing. It started in Kenya in 2012. I know a lot of people have been going out of the country, but now it's available. We give advice on that because there are quite many questions on it. Mainly children, but even for adults, there are some who are being implanted. And there are new devices which are coming in the market. A continuation of rehabilitation, there's the Kenya Sign Language. It's Kenya Sign Language. There is the American Sign Language, the British Sign Language. But in Kenya, sign language is different. Some signs that you give are different from other countries. So Kenya Sign Language is recommended and it's available. Children with hearing loss, school placement, we advise either on inclusive setting, whereby teachers, you keep the child in a regular class, but with additional support, or in special school placement. Early intervention programs, when kids come to us early, we start some activities which assist the child and the parents to cope with what's happening and teach them before they get older. Speech therapy is where we support people with activities to enhance and accelerate their speech development. Parent support groups are important. I've met many parents who have told me, I don't know anybody who has a child like that, and it's lonely. You know, all our dreams are the ideal child, but when the real child comes, you are faced with it, you have to go on. So we bring parents together so that they can support each other and also get help. And counseling is paramount because we have a lot of superstitions that it happened because you didn't do that. Bride price, I don't know, you insulted who or you laughed at somebody when you're pregnant. They are still there, let me tell you. We are educated, we are getting more educated, but I've seen superstitions. They are in all levels of society. We also give training for those people as a rehabilitation aspect of hearing loss. And in conclusion, and maybe some of them are recommendations, in developed countries they have what they call newborn hearing screening or universal hearing screening. Children do not leave the hospital before they are screened. It is one of the tests that is done. And this is good for children who are born with deafness, genetic or otherwise. Early identification. If you suspect, like we said, your child is not turning to your name or whatever, or is not responding or seems to ignore you, it's important. Early intervention is between when you know and school, the kind of activities we should do so that we get the most out of the most critical period of a child's growth. Then timely and appropriate treatment. Let's not wait until the issue is out of hand. Let's go as soon as we know there's a problem, appropriate, before we try all other. I've had mafuta ya buduki, I've had chicken oil. Somebody even talked about the tail of a chameleon. People do a lot of things. Yeah. Please, let's go for appropriate treatment. And then awareness creation. Let's, creating awareness all over. Because I said hearing loss is really invisible and silent. You don't see it. And especially children, if you're born with it, you don't know what you're missing. You didn't hear, you have never heard, so you don't know. So let's create awareness. And in schools especially, I love early childhood teachers. They pick out what parents have missed. And they have a very tough time because they tell the parent, I think your child has a problem. And those teachers get into a lot of problems. Am I the mother or you? Wewe ni daktari ama? But okay, it should be, we teach them on how to share that information. Because also the way it's said, wewe hujajua mtoto wako hasikii na umemleta. It is a way of doing it. Also prevention. Remember we said most of the hearing aid causes are preventable. There are many things that we can do to prevent. And medical outreaches, like the camp we had yesterday, that's a wonderful time that people come out because also services are expensive and some are not accessible. And there are many things that are done in hearing and ear care. I don't know whether I said I work at Kasarani, opposite the police station gate, and also in Vika. We have many services which are also offered in other hearing centers, and they include all the tests are there, and also the rehabilitation that I have mentioned. We give all the services in our clinic. And yesterday, for the people who came, we saw them, we referred some of them, and whoever was given a referral, we said we are going to give it at half price. Today, if you're interested, you know somebody, or you have an issue. The 3 people I'm with, where are you, please? Let me see you. Yeah, the 3 of them. I can't see you, people. Good, thank you. Yeah, the 3, we have brochures. As we go out, you can pick from them at the doors. If you come, it will still be half price for any service that we shall give you for this, in honor of this outreach and camp. So I talked about cleaning your ears. I remember one of my professors, I think it's a WHO advice, they were telling us the smallest thing you should put in your ear should be your elbow. So even if you don't remember anything I've said, remember, kama unataka kuweka kitu kwa sikio, weka elbow. And I think with that, I'll say thank you very much for this opportunity. And I hope it will be of help to you, or you can share this information with any other people you think might require help. Asante sana.
We